Welcome, friends. Great to be back, and we are now ready to begin our session. And may I request now Dr. Lakshmanan to please start the proceedings. Dr. Lakshmanan, over to you.
Greetings, Satish, Chairman of our Canada-India Foundation. Friends, Canada-India Foundation is an institution formed to focus on public policy. There are other institutions serving areas of trade and commerce, cultural activities, but Canada-India Foundation specifically focuses on public policy. Achieving that goal, the institution has been organizing summits, forums, and conferences. The earlier conferences included mostly for the economic activity, energy, mining, agriculture, infrastructure. The board discussed together, and we wanted to offer our services in the area of societal care and social policy. With that in mind, we took upon ourselves to organize summits on healthcare and education. We had organized 2 healthcare summits before, and the third one, which we are running now. In this third conference summit, discussing with our partners, we wanted to focus on technology because question asked by everyone around the world, how can we get affordable care, quality care without compromising the quality? Canada is a leader in the world on universal health care with investment in universities, world-class universities. UHN ranks as number 4 in the world and the best in Canada. India is a leader in digital technology, pharma hub. It is serving the whole world and the demographic advantage. Together we saw a great opportunity, Canada and India coming together, using technology as a tool to address the challenge posed by giving affordable care uniformly to all of our citizens and quality care. In knowledge economy, innovation plays a major role. So together, the organizing committee, after deciding to hold this conference on with the COVID, with artificial intelligence and the biotechnology combined as a theme for the conference, the committee members came together and discussed, and we saw it is very important to address, recognize the issue that can be helpful, promoting the research done by youth, youngsters, be it in Canada, be it in India. So Canada-India Foundation, together with the organizing committee members, decided that we will announce awarding youth under 40 for their innovations. And working with KITE, working with UHN, gave us an opportunity to understand the work that they have been doing for many years through KITE in recognizing youth and giving awards. We in Canada-India Foundation, with partnership with UHN, FICCI, and Consul General, we together decided this is a major opportunity to encourage our youth who can create in the global village to develop technologies that can bring the cost of delivering healthcare service lower, affordable, at the same time not compromising on the quality. With that in mind, Canada-India Foundation went ahead and announced the awards. We started with 5, but the enthusiasm was so great. From 5, it went to 6. And we also got sponsors from India as well as from Canada to support. The recognition that we received from our sponsors clearly underlines the topic that we have chosen is current, very important, and the subject healthcare, innovation, and affordable. These all play major role for creating jobs, for the health, creating healthy human capital. With that in mind, we made the announcement, and we got good response, and the results will be declared today. And I now request our colleague, Professor Arun Chokalingam, to share his thoughts on this competition. Professor Chokalingam.
Thank you, Dr. Lakshman. Thank you for your leadership and for your visionary ideas, which led 5 or 6 forums through Canada India Foundation, and then the 3 healthcare summits. And I'm fortunate to be part of all 3 of them. In the first one as a speaker, and the second one as a co-host, and then now working very closely with you and other eminent people like Satish, Milosh, and many others from different organizations, including Srimati Apurva Srivastavaji. And this conference has taught us a lot of things because we did this in such a short time and as a virtual conference. And once we agreed upon putting this awards competition together, we had only 3 months to announce this and then to encourage people. And we went on till the 10th of May to receive applications so that we will have enough responses. I must say that there is an overwhelming response and they are all good quality applications. If we have got the money, we could have given to all 31 of them. And they were all of very high standards. And we received about, say, 25 applications from India and about 6 applications from Canada, and for over 31. Then because this conference, this summit is focusing on the 3 major aspects: artificial intelligence, biotechnology, and pandemic response and initiative, we opened it for general healthcare, but with a preference to these topics. Of the 31 we received, we had 12 in general healthcare. About 9 applications were from artificial intelligence, 2 from biotechnology, quite understandable, and another 8 from pandemic response and initiative. And can I have the next slide, please? Can you give me the judges, please? So, and we had 2 rounds of judging. We had 2 rounds of judging to select 5 winners. And in the first round, Dr. Lakshmanan, Mr. Satish Thakkar, Mr. Kalyan Sundaram, who is the backbone of this whole conference, and Dr. Vinod Vyas and myself. We did the first round of selection, and it was quite an intense evaluation. And in 2 days, we just put everything aside to analyze and to give equal opportunity for everybody, and they were ranked. And we said we will select 10 to give it to our next round of judges. And I'm sorry, I think I missed Ritesh Malik, who's also in the first round of judging. So we did that, and then we said we will select 10 for them to select 5. But it so happened that the 10th and the 11th were a real tie-up. So we said in the benefit of it, we will let all 11 of them to go to the second round. So the second round was even harder for people like Dr. Padma Bhushan, Mrityunjay Atreya, Dr. Grant Pierce from Winnipeg, and Dr. Miloš Popović from UHN, who is running the KITE innovation program year after year. So they have the experience and the vast knowledge, and they have done a thorough job, and they came back with their independent scorings. And once again, there was a tie between the 5 and 6. So we decided to give a total of 6 awards, and we will soon hear about the award recipients. And before that, let me ask Dr. Miloš Popović to come and say his reflections. Dr. Popović.
Thank you, Dr. Chucklingham. I think that was, I had the privilege to see 11 applications, and all of them were very strong. It was kind of difficult to make a judgment. What I did was I read 11 of them, and even prioritizing them and deciding which ones would be should be the winners. I think that was not an easy task. I think there are a lot of exciting applicants. There's a lot of excellent, very practical ideas. And I think those people who will not receive these awards today should not get discouraged. They should actually feel very strongly about their ideas and products and processes they're putting in place. And they should pursue them with vigor and enthusiasm as they're on the right track. We're absolutely certain as a committee they're on the right track, and I would like to encourage them to do that. And the winners, Dr. Chucklingham, you can announce them.
Kalyan, you can now play the video, so that will mention where these people are coming from. And we have chosen one on general healthcare, one on artificial intelligence, one on biotechnology, and 3 on post-pandemic or pandemic response and initiative.
CIF Canada India Healthcare Innovation Awards.
Hello everyone, my name is Muthu Murugappan. I'm a director on the board of Valenza International based in Eustis, Florida. We are a nutraceutical ingredients company specializing in scientifically backed and clinically proven nutraceutical ingredients. We are sponsors of the CIF Canada India Healthcare Innovation Award, and we'd like to thank the Canada India Healthcare Summit for instituting these awards and encouraging young entrepreneurs. The Canada India Healthcare Innovation Award goes to Mr. Ravi Avasarla and his team at Sterl Air. We would like to congratulate Mr. Avasarla and his team on being selected for this award.
Hello, I'm Ravi. I am the co-founder and the Chief Product Officer at Sterile Biosystems. I would like to thank the Canada India Healthcare Summit and the Canada India Foundation for instituting the award. I would also like to thank the award sponsors, Mr. Muthu Murugappan and Valenza Nutraceuticals, for funding the award. Sterile Biosystems is a medical technology company based out of KICCCMB, which is the Center for Cellular and Molecular Biology, based out of Hyderabad. We are building the next generation of infection control in healthcare settings with the help of a continuous disinfection system called Sterile Air. The system has been clinically validated at Narayana Hridayalaya in Bangalore and is undergoing testing and validations at numerous hospitals around Hyderabad and Bangalore. Thank you.
I am Anand Seshan, co-director of 5G Technologies Limited, a Canadian company specializing in applying smart platforms and AI-based solutions to the manufacturing domain.
Hi, I'm Sumitra Seshan, co-director of 5G Technologies Limited, and we are very happy to be here.
Our company is a sponsor of the CIF Canada India Healthcare Innovation Award, which will go to Mr. Kanishk Karbanda for the multi-mask innovation.
We congratulate Mr. Karbanda on being selected for this award.
We also wish to thank the Canada India Foundation for instituting this award. Thank you.
Thank you.
I am Kanishk Karbanda, co-founder of Med Interventions and Beyond, and I'm accompanied here by my co-founder Deepak Patania to accept the award for Multi-Mask, the world's first transparent modular mask with an attachable shield. On behalf of our entire team, I would like to express my gratitude and thanks to Canada India Healthcare Summit and the Canada India Foundation for instituting this award. I would also like to thank the award sponsors, Dr. Anand Seshan, Sumitra Seshan, and 5G Technologies. I want to say that through the course of our multi-masks development, we came to realize that it had the power to make a significant dent on the spread of the pandemic if it were to exist in early 2020. Well, we are now very close to the launch now and hope that multi-mask will still be able to live up to its promise of protecting lives in the future like never before. This award is surely going to take us one step closer in meeting that objective. Thank you very much.
Hi, my name is Ravi Kumar, and on behalf of my father and father-in-law, Dr. Sundaram Nand Kumar and Mr. Subramaniam Ramaswamy, we are proud sponsors of the CIF Canada India Healthcare Innovation Award, which this year will go to Dr. Dinesh Krishna for his innovative application, Enabling Inclusion. We want to congratulate Dr. Krishna on being selected for this award.
Hi, my name is Dr. Dinesh Krishna, and I am the co-founder of the Enabling Inclusion app and model and the co-lead of Amar Seva Global. I am also a lecturer at the University of Toronto and a physician at North York General Hospital and a director at Handicare International, a disability charity in Canada. Thank you, CIF Canada India Healthcare Awards Committee, Canada India Foundation, and the award sponsors, Ravi Kumar and Kavita Subramaniam. The Enabling Inclusion app and program is truly a Canada-India collaborative effort. The award will go a long way towards giving us amazing visibility and mainstreaming our application for the benefit of children with disabilities around the world, affected by COVID-19 imposed social isolation. Enabling Inclusion is a technology-leveraged solution for delivering early intervention rehab services for children with disabilities. Through Amar Seva Global, we will be replicating, co-creating, and scaling up our innovation throughout India and to other low and middle income countries globally to reach millions of children so that all children can reach their potential. Thank you.
Hi, I'm Choco Valiappa from the Sona Group of Institutions. Sona has been in education for 64 years, graduated over 200,000 students over the years, and we have a special association with Canada going back in the Canada-India Institutional Cooperation Project way back to the 80s, where they get the best practices of education to Sona, to Tyagaraja Polytechnic in India. We are very delighted that the Canada-India Healthcare Summit is taking place today at the timely juncture, and also wanted to thank the organizing committee for putting this thing together and organizing the student competition, because young minds are needed today. And I'm delighted to announce the winner, Sanika Venkatesh from Latiga, developing a therapeutic project, which is very timely. Thank you.
Hello, my name is Sanika Venkatesh, and I'm the project manager for Latiga. We want to thank Canada-India Healthcare Summit and the Canada-India Foundation for instituting the CIF Canada-India Healthcare Innovation Award. We also want to thank the award sponsors, Mr. Choco Valiappa and the Sona College of Technology. A brief overview of our company. Latiga is an award-winning venture-backed biotherapeutics company developing novel biologics to treat and prevent infections with a focus on improving the quality of life of patients with primary immunodeficiency diseases. We are unlocking the full therapeutic value of human milk to create the next generation of anti-infectives that can battle even the world's most dangerous pathogens. Thank you everyone once again, and congratulations to the other awardees as well.
Hello, this is Choco Valiappa from the Sona Group of Institutions. Wanted to recognize another awardee, Nikhil Kurela from NoCare Oxygen Concentrator, for developing this timely oxygen. The world needs it. Thank you.
Hello everyone, I'm Nikhil. I'm co-founder and CEO of Nokak Robotics. And I would like to thank Canada-India Healthcare Summit and Canada-India Foundation instituting the award. At the same time, I would also like to thank our Mr. Choko Valiappa and Sona College of Technology for honoring us with this award. We at Nokak Robotics are building ICU ventilators and high-flow oxygen therapy device with an aim to bring healthcare affordability in different tiers of the society. I would like to thank again for honoring us with this award.
Greetings, friends. Canada India Foundation is very pleased to award Dr. Saugata Das of EDAS Innovations on her work on last mile distribution of COVID vaccine. Dr. Saugata Das' contribution with an innovation can play a major role with the knowledge economy, creating partnership between Canada and India. We from Canada India Foundation feel very proud that we can be part of Saugata Das initiative. Thank you.
Hello, I'm Dr. Saugata Das. I'm a researcher and innovator. I guess I always had a knack to design solutions for tackling real-world problems. And that is how I ventured into entrepreneurship and co-founded IDHA Innovations with my partner, Dr. Nisha Yadav. It is an absolute honor to be receiving this award, and I'm really thankful to the Canada-India Healthcare Summit for providing us with this recognition. I'm also extremely thankful to the award sponsors, especially Dr. V.I. Lakshmanan, who is himself a renowned scientist and innovator, and the Canada-India Foundation for motivating and supporting innovators like us in our entrepreneurial journey. IDHA Innovations is a medtech startup where we are committed towards supporting healthy living by designing smart, affordable, and quality solutions. This CIF Healthcare Innovation Award is an appreciation for one such medical device which aims to tackle the issues associated with the last mile distribution of vaccines. I would like to end with a big thanks to all the organizers of this summit.
Thanks, and congratulations to all the winners, and also congratulations to all those who have applied. Every one of those applications are phenomenal. Over to Dr. Lakshmanan. Dr. Lakshmanan, you are on mute.
Friends, on your behalf, I now will request our Consul General, Srimati Apurva Srivastavaji, to share her thoughts and give her greetings.
Purvaj, you are on.
Thank you, Dr. Lakshman. What a outstanding two-day conference, power-packed, totally, delighted. It is, it's so heartening to be part of such a noble and such a great endeavor and such a timely endeavor, because, all the discussions that took place were in the backdrop of this COVID-19 situation, which the whole world is dealing. India, especially dealing the second wave, which is really, it's really hard for us. So in this context, it has been a great show. Some of the sessions I was not able to see, but I can always go back and see the top names from India and Canada. Thank you, Canada India Foundation. I have been naming all five of you who have been I share the screen with. So again, Dr. Lakshmanan, Dr. Chukalingam, Mr. Popovic, Milos, and thank you, for yesterday. I was not expecting it when you named me along with Dr. Lakshmanan. So thank you so much. I was really moved and touched. Thank you, Milos. Satish ji, Ritesh, you guys have been really working very hard, and all credit to you. My heartiest congratulations to you. And I'm really delighted to see the kind of prizes that have been the innovation awards, the very, very timely again, masks with shields, there was oxygen concentrators, very timely. we have to find a way how to, we take it forward, and how do we integrate into the whole system in Canada and in India. So that's why we had this discussion with Startup India, and I've already requested them to think about something. And and for me, this health summit is a beginning, and we have to follow up a lot of things. So I'll keep on following up, and we'll all have to work together to what the wonderful outcomes, the concrete ideas that have come out of this summit. We really have to implement it. I have already got several requests from Indian counterparts, for instance, from AIMS, to have more collaboration with Canadian institutions. So all that we have to follow up and work for it. So again, I don't want to take too much time, but thank you so much for making us part of it, and thank you for all the efforts. And it has been a great summit. Thank you.
Thank you very much, Apurvaji. I now request Mr. Satish Thakur, our chairman, to say a few words.
Thank you, Lucky Bhai. First and foremost, very heartiest congratulations to all the award recipients. What a catalog of the best mind which we can see. It's a business, entrepreneurship, innovation. Those are the founding stone or the backbone of any kind of economic activity or economic growth. And when the young minds attach to it, I think there is potential is immense. Like it's a untapped potential which we try to kind of target through this initiation of this award. And on top, it's a Canada India Healthcare Innovation Award. So that is basically bringing how to improve the quality of life. That is what are the ideas which we saw through all the review process of the nomination. Of course, we had over 30, as Dr. Chokalingam mentioned, our nominations, but we had certain set criteria which we had to go through, and we kept it broad in terms of whether it was a kind of a concept development stage, prototype stage, or a new startup stage. So those were certain criteria, and also there was a certain kind of a business planning angle to it. So the people or the persons who could not make it, that does not mean their idea were not great. I would say we could not find even a single nomination which did not impress us. But since we gave our weightage based upon different criteria, so they could not make it. But at Canada India Foundation level, as we mentioned earlier, youth initiative is very core to our heart, and we are looking forward to connecting with you all the nominees, and see how we can help you further in your journey of a successful entrepreneur, and also providing a very long-lasting, tangible solution for the public good. And once again, heartiest congratulations, and a big thanks to all the judges for their time. They spent, it was a very short notice. We closed the nomination on 10th, 11th, and then we have to select, and then we have to reach out to all the sponsors to get the videos done and the award recipients. So it was a quite timely process, time consuming. But I want to personally, on behalf of Canada India Foundation, also thank all the judges as well as all the sponsors. And I have my colleague Ritesh Malik, National Convener for Canada India Foundation as well. So I would ask him to share some of his thoughts as well. Ritesh, over to you. You are on mute, Ritesh.
Namaste and greetings of the day to everyone who joined us on this important Canada India Health Summit 2021. My name is Ritesh Malik and I'm National Convener with Canada India Foundation. It has been, as everyone said, Apurva ji, Lucky Lakshman ji, Satish ji, it has been such an exciting 2 days of conference, and it was such a great content very apt for the time. And we are thankful to everybody who participated from India and Canada. Our dear Lucky ji, I mean, he's been the pioneer in this. He's been inspiring us, guiding us. And it is his hard work and Dr. Arun Chakalingam's hard work that we were able to deliver a very power-packed 2 days of content. And we look forward to these new young innovators who've been awarded on this conference, and we look forward to collaborating with them more and seeing their ideas turn into reality and help people in real world and post-COVID scenario. Thank you very much.
Thank you, Ritesh, and over to you, Dr. Lakshman.
Well, friends, we'll now move into the next item.